If you have sciatica, listen to this. It's maybe impacting you. So what is it and what should you feel if you have sciatica? Sciatica is pinching of the nerve somewhere on the pathway of the sciatic nerve or the nerves in the lumbar area of the spine that come out somewhere along that pathway. It comes out of the back and goes down the butt and down the leg. And typical symptoms are pain going down the leg, numbness, tingling, sometimes tingling even into the foot. It can come and go. And so the typical treatment is, well, where is the impingement? So the impingement is looked at typically through different means of scanning. Typically, you start off with an X-ray, which won't show these things, but that's the first place you look. But the next one is the MRI. And so what is the common places of impingement that causes sciatica? The common ones is the nerve root from the lumbar spine and the disc coming out, pushing on the vertebra, the foramen exiting the spinal canal. It can be pinched too, which can happen from arthritis of that area. All these cause a narrowing pathway of the nerve going down the leg. One commonly misthought or diagnosis of sciatica is the piriformis muscle pinching it. The piriformis muscle is a muscle in the buttocks area, and you will quite often see that people will have numbness or pain when they sit on the toilet. If they lean on that side of the buttocks, they'll notice pain when they cross their legs. In that case, it's a different approach. But most commonly, it's through the spinal area. And so people will tend to treat this conservatively with time, through steroids, with pain medicines, with chiropractic treatments for hopefully opening the area so the sciatic nerve has room to travel. And then there's surgical procedures that can be done. Hopefully we try to do things conservatively with medications, physical therapy, and even time. So I try to avoid surgery as much as possible. 5-year follow-up in a study shows randomized controlled trial of patients in the British Medical Journal. The study found no significant difference in pain and disability scores between those who underwent early surgery and those who received prolonged conservative treatment. Notably, 21% of patients reported unsatisfactory recovery at 5-year mark. Predictors of poor outcome included age over 40, severe leg pain at baseline, and higher effective pain scores. Here's a 10-year follow-up from the main lumbar spine study, evaluated patients over a decade and reported that both surgical and non-surgical groups experienced improvements in symptoms. However, the patients in outcomes between the two groups diminished over time, suggesting that the initial benefits of surgery may not be sustained in the long term. So we try to be conservative. If you need to do surgery, if it hasn't been looked at, these are things that you can always consider. Last but not least, in a conservative approach, but semi-conservative, is injections of the spine. They call them epidural injections, facet injections, typically through a pain management or interventional radiology. Thanks for watching. If you like the video, like and subscribe and share. If you're interested in becoming a patient, if you live in the Orlando area, you can find our office and me and the other physicians in our office. You can look at our website. I'll place that link in the description. And if you're interested in watching the next video, click up here or there or down below.